This is Frequency, a production of the American Academy of Otolaryngology, Head and Neck Surgery.
Hi, I'd like to welcome all of you to episode 10 of the American Academy of Otolaryngology, Head and Neck Surgery's COVID-19 podcast series. I'm Joe Shapiro, Associate Professor of Otolaryngology, Head and Neck Surgery at Harvard Medical School, and I was the founder of the Center for Professionalism and Peer Support at Brigham and Women's Hospital. Currently, I'm Senior Faculty for Center for Medical Simulation. I'm so happy to be joined again today by my colleagues, Bill Blythe, Sonia Malexiday, and Julie Way. I'm going to ask each of them to introduce themselves. This episode will be the second part of our physician wellness discussion, and there's going to be more on the way, so thank you all for being here. I'm going to describe a bit about how we're going to structure this episode, but first I'd like my colleagues to introduce themselves.
My name is Bill Blythe. I am a general otolaryngologist in private practice in Auburn, Alabama, and I am a member of the board of directors for the American Academy of Otolaryngology as one of the directors at large for private practice.
Welcome, Bill. Thank you.
Thank you.
Hi, my name is Julie Way. I'm a pediatric otolaryngologist at Nemours Children's Hospital in Orlando, Florida. And I'm delighted to connect this way today because I'm kind of mourning that this was the COSM weekend. We would have all been in Atlanta together. So thanks.
Yeah, thanks for that. Good point. Thanks for being here, Julie.
Hi, Julie, Joe, and Bill. I'm Sonia Malexiday. I'm a general otolaryngologist at Georgetown. I am in academic practice, obviously, and my clinical practice is mainly over at the VA hospital, but I'm also the residency program director here at the institution. I'm also a director at large academic for the American Academy of Otolaryngology Head and Neck Surgery Board of Directors, and this year I'm the chair of the Otolaryngology Program Directors Organization. So thank you for having me.
Well, again, so happy that the three of you are here. The structure today that we had agreed to is going to be a little bit different from some of the other podcasts, and that is I'm actually going to do peer support for the three of you. I'd like to be there for you and let you feel what peer support feels like. So there's going to be not much about explaining, didactically or anything like that. And the other thing I wanted to mention is that we're going to be recording more podcasts to deal with and focus on other elements of physician well-being. So this is just one aspect we're focusing on today, but there's going to be other facilitators in this group, and we'll have different topics that we're going to cover. So today is really focused on doing actual peer support. So again, welcome to the three of you. What I'd invite each of you to tell me about is what's going on for you? What are you doing? Are you seeing patients in the hospital, a clinic, not at all? What's happening? What's your world like? Home too, if you want to share that. Just tell me your current reality, if you wouldn't mind sharing. And I'm just going to start by inviting Bill to comment on what's happening for him.
Well, thank you for having me, and I appreciate everyone's participation today. I'm humbled to be here. We've had an interesting past almost 6 weeks now. I am still practicing, obviously. I'm still working. Our office is shut down to maybe a fifth of the normal volume that we see. We're under a state order, as most of us are, to only see emergent or urgent or time-sensitive patients. So instead of seeing 60 patients a day in clinic, we're seeing more around 10 or 15 a day in the clinic. Mostly our cancer patients, mostly our patients that have home trachs and those sorts of things. As far as the hospital goes, my partners and I take a call for a week at a time, every third week. That's really the only time we're going to the hospital is on call. Well, our hospital is shut down completely for any thing but emergency and urgent surgery. So I've not been in the operating room for over a month. So that's what we're doing. I spend a lot of time on Zoom. I spend a lot of time on FaceTime, and a lot of time kind of at home alone. So I haven't seen my parents. Both of my parents are still alive. I'm very lucky for that. My parents are in their 80s. They're both still alive. I have not seen them in 6 weeks, and I'm looking forward to seeing them soon.
Sure, that's hard. Thank you for letting us know what's happening with you. And Sonia, what are
Yeah,
you doing?
again, very similar to what Bill described. My clinical practice is over at the VA, and everything has really sort of come down to a screeching halt. We're doing telehealth 1 day a week for our patients, and every once in a while we'll see somebody who really needs a physical exam. We can't get the information via video and Skype. So that's what we're doing in terms of the clinics. Operating rooms, similarly, just the urgent cases, airway. We've had to do a couple of pen endoscopies for cancer diagnoses, and just sort of a rare laryngectomy neck dissection we had in the tours last week. I'm also the residency program director here at Georgetown, and so a lot of my time and energy has been on the chaos of what's happening with our residents. So I've tried to focus on the residents and the residency program. We've really had to restructure the entire rotation schedules for the residents and reorganize them into 2 large teams across the city so that they don't interact with each other. They're isolated in these 2 parts of the city. And then within each of those teams, we have 2 teams where one works a week, the other week, and then the other team is at home, and then they switch, vice versa. And the goal, again, just to limit exposure, but ensure that there's a core group that's taking care of the emergencies and the consults and things that need to be seen.
That's got to be.
There's also
Go ahead.
I was going to say there's also chaos at home. I'm sure, like many, all our kids are on virtual education and virtual learning. I have 2 college boys who are home now, and that's a challenge in and of itself, having these grown men who are independent to be back under the roof. I have a high school son and a 6th grade daughter, again, doing virtual education. My husband, he's a private practitioner, and he basically shut down his office a month ago. So stress and anxiety is palpable at home as well as work. And again, we're managing it just like everybody across the country.
Yeah, that sounds all sorts of layers of potential stressors for you. So we'll dig in a little bit more to that. Thank you for catching us up. Julie, how about you? What's happening in your world?
Yes, so thank you. I'm in Orlando, Florida, in a freestanding children's hospital. I serve as our division chief. I serve as our wellness, well-being program director for the residents and faculty. So those are areas of my passion. So similar to what's been shared, the only thing is, I certainly feel guilty, one, almost during this pandemic, for being a pediatric otolaryngologist, because unlike my adult colleagues, right, that the risk and the experience is so much closer to home, and the stress for all of you. And then also compared to my pediatric ENT colleagues who are in epicenters like New York. Having said that, in our children's hospital, whether you're in the epicenter or not, you still have to do what everyone else is doing, right? So very few patients clinically, the urgent ones, cases, my partners and I joke about how, oh my gosh, we've never experienced a period of no tonsillectomy bleeds. Our rates were low before, but still, right? There's a bonus. But the truth is, everybody knows the ED census is down, the hospital census is down. We cleared them out intentionally, right, in preparation for the surge that still, only hit, I think, South Florida primarily. I'm sure you've read and heard about that. I find that, so I serve as our chief. We have 11 providers on our team. I certainly, make the schedule, make sure that we do as much telehealth as possible. We actually, I'm sure we'll explore this later, as we now, I can't believe it's the last week of April coming up. So as we start to continue to be in so many meetings, talking about and planning what recovery looks like for surgery, for the clinic, and how to do that safely. I find that that's taken up time that is necessary. But I've also enjoyed have had the time to continue participating in activities that I value outside of my organization. So like yesterday was an ENT Today editorial board meeting by Zoom that Sonia was on as well. I've enjoyed writing and, just yeah, just trying to take it all in. And then at home, we just have our awesome 14-year-old single daughter. Biggest regret is her going to miss the move up dance from 8th grade to freshman year. You know, when we all heard, right, the announcement, I think for most is your children are not going back to school the rest of the year, you know, and thinking about the impact on her, but we're so blessed. But I think about my team, you know, childcare, you know, so there's so much still going on. But I'm guilty. I'm in Florida. The weather is mostly nice. It's beautiful and spending time. But the one final thing I'll say is more time with your spouse than ever. And in some ways, I think, wow, you have to be willing to use the opportunity for some discomfort when you have had time to have conversations, much deeper conversations than the ones we typically do for daily living. So
that is really an interesting challenge that you just brought up. And actually, the three of you, I wanted to say that. First of all, thank you for sharing, and also say that I think we are, though we're all in different circumstances, specific circumstances, we're all exposed to very similar variations on different emotions that have arisen through these circumstances. And I'd like to just invite any of you to share what it, and I think some of you've touched on it already, but just to explore a little more. So, you know, I heard that, you know, there's some kind of gratitude for like what you can do at this point, and opportunities, and also some feelings of guilt. Julie, you brought up, and there, I'm sure, are others. And I'd just like to invite any of you to talk about just what kind of emotions have come up for you during the pandemic. Prefacing it by saying that I could pretty much guarantee that anything you say will have been experienced by either one of us or one of our colleagues. So these are very real emotions that people have, and I'm just curious if any of you would be willing to share. Yeah, what's been the emotional impact of all these changes on each of you? Let's see. Let me specifically, Bill, would you mind commenting on that?
Sure. Gosh, I really don't know where to start. For me, there's been a tremendous amount of restlessness and anxiety through the course of this. I have a number, gosh, there's so many different levels of things that I've been worried and concerned about. I do want to start by saying, though, that it has given me a fresh perspective. And every single day of this pandemic, I'm grateful that my parents are both still healthy and both alive and have not gotten the virus. As a matter of fact, no one from my clinic and none of their extended family members has been affected by it. So I'm very grateful for that. And I think I have had a change of perspective on that. My partners and I, over the course of the last year, made a change in our practice. We brought in a total of three advanced practice providers. And we did a threefold increase in the clinical area, bought all new equipment. So we just completed a major expansion that was very, very expensive of our clinic. And we've just brought in a lot of new providers. Each provider requires support staff. And so literally over the past 12 months, we've just increased our overhead and our physical space and our expenditures and our personnel by a factor of 2 to 3. Then all of a sudden this happens and we have nothing to do with any of them. And we really right now just barely have enough patients for one provider, much less 6. And it's been difficult. I've been working with the same people at my office since 1997, and I haven't seen many of them recently. We furloughed most of the staff quite early in this for 2 reasons. First of all, because for economic reasons, but also because we didn't want to expose them unnecessarily. So I miss them. They're really part of my family. There are tremendous financial concerns on our end. I don't want to take up the whole podcast talking about that, but just on every level, we're worried about not only the payroll, but there have been some some help with that from the government. Our personal income, most of our debt structure is made around an expectation of a certain level of income. I'm worried about my employees. I'm worried about the financial health of the practice, and this is in the context of a big expansion.
Thank you for sharing that. This is such a common concern because these financial concerns then generate all sorts of emotions because we're caring, compassionate people. We're, this is affecting people that we've hired or that even if that's not the case, that we know and care about. So I think this sense of loss and concern and uncertainty about other people's lives, how this is going to affect them. So thank you for sharing that, Bill. Julie, would you want to, you did already talk about feeling guilty, and if it's okay with you, I just wanted to highlight that because I think a lot of us feel guilty. I think it's very common. It goes along with the culture of medicine, and I think it has to do with feeling that somehow our suffering isn't that other people are suffering more. And in your case, you mentioned your colleagues who do adult otolaryngology are having to work harder or be exposed to patients and have these other concerns. And I just want to just say that I think that's your feeling of like, I'm not doing enough, if you will, even though I also am going to point out later you're doing a ton of the great things, but just that feeling, holding that feeling of feeling guilty, with my doing peer support for you now and just generally is having us be able to say, like, yeah, that's okay that you feel that way, and also knowing that it's not comparative suffering. You have a right to feel what you feel, and whether it's less or more than someone else's is irrelevant. You have a perspective, so that's great. So I just want to to point that out, and then maybe ask you a little bit more about that, or even are there other emotions that you've had that you would want to share?
Yeah, thank you for validating the feeling. I'm grateful that if you asked me 5-10 years ago, I probably would not be further equipped to acknowledge the feeling and let it go, understanding that, God forbid, the next pandemic affects primarily children. Then it would be flipped, right? And then just listening to Bill, listening deeply to not just his words, but what he's going through, right? Naturally, the guilt is, oh, who would have thought, I mean, I chose academic medicine. I chose to be in the setting I'm in. I'm blessed right now to be an employee. We're the largest pediatric health system in the nation. We're a completely employed model, and we're grateful, right? Gratitude comes up when our CEO and the board, they're making us whole, so we have a weekly PEDS-ENT Chiefs call with my colleagues across the nation. And when you listen to whatever the structure is, people taking a pay cut, and we're all very blessed. I would never pretend, even if I took a percentage pay cut, I have to worry about putting food on the table. But anyways, so I have learned as I hopefully keep growing, that self-awareness is emotions are like the Rumi poem. It's the guest. You welcome it, it comes. You always embrace it. It's part of you. And then you let it go and try to come back to your whole self and your core. The other emotions that I've not only identified, but am beginning to really try to understand it so I can manage it as constructively and healthy as possible. One is anxiety, right? And then I recently, it's very clear, I can give you all kinds of examples, but around COVID, it's when you don't have maybe not enough information, but sometimes too much information. Yes. Or different information. And you're like, dude, it's like studying for the boards. Give me the correct answer so I can take that and run with it. And I'll tell you specifically, right? This week's call, when you listen to these accomplished colleagues in well-reputed hospitals and institutions, and there's a variety of which test assay, who do you test when, whoa, it's just like overwhelming, especially when you plan to recover and envision what the future looks like when patients come through and you're doing surgeries again. Then I
So,
realized,
sorry.
yeah, anxiety comes from when you don't know. That is just not something we as physicians and surgeons, we don't always know 100% biblical truth on the science because it evolves, but this is really uncomfortable, period. When was the last time I didn't feel confident in executing and serving my team and having a plan, So understanding it, sitting with it and saying, Julie Way, today is one day. The best you can do is the best you can do today. And all this is fluid on the organizational level. Information changes every day. So sitting with that and just letting it be okay without trying to manage something I can't. I think that's been helpful. And then one final thing is those of you know me on this podcast, and others who may know my intentional focus on positivity and gratitude, really to save myself. One thing as chair of our health and wellness committee for the medical staff, I'm very proud. Yesterday, we launched an initiative. The frontline heroes of healthcare, we're getting all this outpouring and attention from the media and the community for doctors and nurses. We decided we're going to honor and recognize our EVS, or the cleaning crew, the environmental services people and security. So there's 100 associates. So yesterday, my committee and I talked about it. We launched a fundraiser, right? We're going to give every one of them, committed to 100 people, a $50 Amazon gift card with a handwritten note, because these guys every single day keep that building so clean. And the security guys, helped me when I kind of had an uncomfortable, threatening situation from a parent, just a couple months ago. So anyways, that's where I am.
Well, thank you. I wanted to point out something that you said, which is you were defining the emotion of fear and anxiety. And I think that is a particularly common category, if you will, of emotions that have arisen due to the present circumstances, especially, and then kind of working back to understanding, as you've done, where is that coming from? And I think you voiced what a lot of us feel, which is holding this uncertainty, for one thing, just plain uncertainty of things that we can't know. There's things we don't know about the virus. There's many things we don't know. We certainly have financial uncertainty. We have educational uncertainty for our trainees. And that's hard. I mean, really, that's challenging. And I think you also talked about another, maybe didn't say it specifically, but I think there's this other emotion around, some degree, definitely didn't say this, but I'm going with it, some degree of frustration and even anger about how things are being communicated, maybe at the federal level, at the state level, at the local level, at the organizational hospital level. It is hard to be told one thing, right, one day, and then have someone else contradict it because they weren't communicating. And so I've heard a lot of that emotion from other peers that I've supported, that the uncertainty is compounded by some, miscommunication, if you will, and that's, we have a right to be frustrated with that. So, thank you for sharing that. And Julie, then the latter part of what you talked about was some of your coping strategies, but which are wonderful. So I just wanted to hold off on that for a second, exploring that a bit more, and then ask Sonia, can you just, you talked about so many things that you're doing, your responsibilities, and they're really huge. I just want to point out all three of you are dealing with a lot. You're doing a lot. You're handling a lot, and for which I'm grateful as a colleague. Sonia, in particular, I was just wondering. So, all of that you're dealing with and juggling trainees and clinical practice and other leadership roles. What's come up for you emotionally in this time period?
So I'd say, what Julie and Bill have described, that resonates with me. I certainly also am stressed, I'm anxious, I feel the uncertainty, I am overwhelmed by all the information and sort of the evolving information that comes and it changes hour by hour. One of the biggest things for me is probably the lack of normalcy and routine that we're all used to. I miss the relationships, being with my coworkers and patients, and then sort of what drives us every day and the purpose that we have. I think that I miss that. I think that, I spend most of my time, I guess, pushing my own emotions aside and really trying to manage the emotions of my residents and my family. I think that's part of my personality, is just tackling the issues at hand. I haven't really focused too much time on my own emotions and how to cope with it. And I know you probably want to get into that a little bit later, but sort of what Julie said is acknowledging the emotions, accepting that so many aspects of this are out of our control. So, all of us are control freaks, and, focus on what I can control. And so I think that that's where my efforts have been, the last couple of weeks.
That actually, especially the part about just not even stopping or taking the time really to think about how you're feeling, to process your emotions, that is a really, really common thread of what I've been hearing from our peers. And I think we talked a little bit about this on the last podcast, and so Sonia weren't on the podcast with us, but the idea is that we're part of a medical culture that has really discouraged our emotional intelligence, essentially, and our self-awareness. And in part, largely that's actually led to this corollary, which is like, your emotions really aren't important. You're there to do your job and take care of patients and families and communities and your own family, and you're supposed to be able to tolerate these emotions, and they're unimportant. The emotions are unimportant. And I think what we know is that, listen, I drank that Kool-Aid as in surgical training and beyond, and I think we all did. We accepted that this is just the way it is. What we now know from so much data is, and before the pandemic, is that's just not sustainable, especially in times of heightened stress. It's okay to do that, for us to have done that as a culture, as colleagues, but it's really not okay for the system and the culture to have set us up that we're not even allowed to, or to think about that. And that's one of the reasons to do peer support, is it's explicitly saying, actually, it not only is okay to talk about emotions, but it's probably helpful. Now, it doesn't mean anybody should be forced to, but having a moment to do that, or some kind of process, and it doesn't have to be formal, to share those emotions. And I see, Bill, did you have something that you wanted to share?
Yeah, I wanted to make a comment and then ask your opinion on this. I'm the sole male on this panel, and I think that for me personally, my male colleagues have a little bit more difficult time recognizing and addressing and talking about our emotions. I know for me personally, I find life easier when I'm a human doing and not a human being. When I'm very busy, when we get up early in the morning and have full clinics and full surgical schedules and lots of other things, I find life actually quite easy. You just do whatever's in front of you. I find that these times of being shut down and having time for reflection, and I find that to be more challenging for me. And I think that, fear and anger are really fairly easy emotions to deal with. I think anger is a very easy emotion to deal with. I think guilt and I think, heartache, I think, are very, very difficult emotions to deal with, particularly from a man. When I went to medical school, our entire lecture on physician health and well-being was, suck it up, buttercup, get to work. And then that was the entire lecture. And I think that we grew up in that context. And I wonder, from your standpoint, do you see a difference between the males and females of being able to identify and deal with their emotions, or is that just my perspective on it?
So that's a great question. From an academic research point of view, I don't think we have a ton of data on this in terms of peer support, but I can tell you I have a vast experience in providing peer support. And I'll tell you from my experience, what I think about what you asked. I absolutely think there are gender differences in emotional awareness. I think there are specialty differences. I think surgeons, all of us, men and women, and are basically it was pounded into us that do your job and put your head down and get your work done, and emotions are for the weak. Vulnerability is weakness, not strength. Self-care is selfish. So I think there's that. I think there's people's family of origin. Some people come from families where there's much more discussion of emotion, and my sister and brother-in-law are practicing clinical psychologists, and so let's just say I've had more emotional discussions than maybe I would have signed up for, but to all good. So I think there are variables, and I absolutely think gender comes into it. I think for sure, because there's societal kind of expectations layered on medical culture expectations, layered on your family, layered on your own wiring. So one thing that I found really important in peer support is never to make assumptions about somebody's emotions. Because even though I know, let's say I know you're a male and you're from the South and what have you, I still don't know what you're feeling or whether you want to talk or how it would be helpful to listen to you. So I have to show up for each of you, anyone I'm doing peer support for, with the knowledge that I don't really know what you're going through, but it is absolutely going to be influenced by gender. And the last thing I want to say about that is, in doing peer support, and I can tell you whether it was where we used to focus peer support, which was for adverse events and errors, but certainly during the pandemic, I think if we're able to set up a culture like in the moment of being able to talk about emotions, I have seen men share equally to what women are sharing. And, I'm going to even say, to you, Bill, that even just in our short time of collaborating on this is I've seen you, absolutely be willing to share emotions. And so I think part of it has to do with the individual, but also how can we set up a way for where people are comfortable doing that. I mean, I'm not going to ask you anything emotional in the middle of your day. You've got work to do. And so it has to be context, and you have to feel safe being able to talk to me if you want to talk to me. So it was a really, really important question. Thank you for raising it. Julie.
Yeah, if I may, I want to comment on what Bill just said. Bill, thank you. First of all, just for all that you are, who you are, but this gender difference is important. It's important because I look at what the Academy has done, and especially the WIO section for this past decade. We talk about, and we're so proud to increase diversity and the number of women in our specialty. But when we come back to emotions, expressions, and how that relates to us professionally, personally, and what you share, right? Buttercup, right? But I'm supposed to be offended, what? I'm not a buttercup. Sonia and I went through where, I'm young enough, but also old enough that as a student, I saw I experienced some horrific, unprofessional treatment towards women. And nowadays we have made it okay to talk about that. But I am very aware of one of the reasons the data shows women are more at risk for high degree of burnout is because all along we try to go along and suppress that, believing that there's no room for that professionally, and to have to work 3 times harder or whatever we think in our heads to prove that we are every bit as good while doing whatever, and biologically being the mothers and with all the emotions, that's what makes us who we are. I think I figured out that you can't pretend who you're not. So finally, growing into my own skin, like you get all of me, all my awesomeness that, some papers of CV may or may not represent, but you get all my emotions. What's interesting is in my journey as a physician leader, I got to tell you, what hurt me was the feedback that I was too emotional. So I just want to stay there for a second. Okay. I've worked and thought I earned my regional, national visibility in my societies, and all that I've poured out for my love for trainees and colleagues, and being on the forefront of being vulnerable and using the pain and trauma in hopes that I can inspire in others and say that it is okay. This is the me that we don't see. We don't see that about each other. And to be hearing that kind of feedback, by the way, from men. I'm not here to say negative things about men. It's tough, right? But now I'm okay with it. So, but I just want to say, Bill, thank you for being willing to bring up, it's hard for women to look at their male colleagues who don't ever really talk about that or share. They seem to always have it all together, until when you look at whether it's physician suicide statistics, right? A lot of them are primarily men. They actually are more successful at that than the women. And so I just didn't want to lose this opportunity to say, may this pandemic be the equalizer for where turns out doesn't matter what gender, doesn't matter practice setting, doesn't matter your individual and professional situations. We're all human, right? So my latest writings are like, I feel kind of like, aha, I just proved, like how many times have we had to say doctors are human? So thank you. This podcast is validating that I'm not entirely crazy, even though I'm emotional.
Yeah, so thank you, Julie. You're talking about both Bill bringing up the idea of like not being allowed to be in touch with your emotions as a man, and you bring up the gender effect on being in touch with your emotions and not being able to express them. And I think, so I think, again, these factors all matter. At the end of the day, that we each handle things differently, and I think, again, something like peer support needs to be provided for everybody, and also understanding that what people's needs are going to be very individual based on all sorts of circumstances. So thank you. I want to if I could, Julie's talked about some coping strategies and has done a lot of work that she's written about and also talked about in the last podcast. So if it's okay, I'm going to ask Bill, what for you in general, never mind right this minute, but in general, what kinds of things when you're hitting an emotionally or just plain stressful period of your life, we've all had them, what helps you? What do you use? What are your and I'm going to say your positive coping strategies? What gets you back on track? So just generally, what are your coping strategies?
Well, for me, I think my very best coping strategy has always been some form of exercise. I was always a runner until I ruined my knees. I do a lot of walking right now, and that's the time that I take to self-reflect, and I try to make a conscious decision to turn off my phone and or at least silence the notifications, and just spend a little bit of time and trying to be in the moment. For me personally, I am a member of the Physician Wellness Committee for the state of Alabama, and I personally actually attend 12-step meetings, and I have for 19 years. And so I do a lot of meetings. I do a lot of meetings with friends and colleagues and people that are in recovery for drug and alcohol addiction. I spend quite a bit of time talking on the phone and FaceTiming and Zoom meetings. We can't have in-person meetings, but do a lot of Zoom meetings. And I found that to be tremendously supportive for myself.
That's great. That's first of all, your personal self-care of exercising. What I didn't ask you, but what you volunteered was that this is something you know is important for you, and you're continuing to do it even while you're in this stressed period of time. And so I just want to point out that a lot of times when I ask that question of peers when I'm doing support, is they'll tell me what they should do or what they used to do, and then I say, are you able to do your running or your gardening? And they'll say, well, not now, I'm just too busy and I can't other people need me. And so what I point out is what I think you all know, and they know too, in their heads, but maybe not in their hearts. And that is, it's actually now that you should do this more than ever. And then I asked for specific commitment to do that. So I'm so glad to hear that. And then to your other and really important coping strategy, your community that you have, that's supported you for so many years, and just how important I think having community and accessing community, even especially during times of stress, is so important. So thank you for sharing, because that is a wonderful community, and what a beautiful thing that you have done that and do that. That's fantastic. Thank you for sharing that. Sonia, if I could just ask you, what just, both what do you generally do for self-care and your support system, and then, the corollary, are you finding yourself able to do that now? Because not all of us are finding that time or space to do the coping things would be helpful to you.
Yeah, I'm generally not good about self-care. Just the idea of exercise, and that just sort of is yet another thing for me to do and check off. So I shy away from that. I want to echo sort of what Julie had said. I've taken the mindset of gratitude, I think, during this time, and trying to see the positives in all of this. And if there's any silver lining at all, making the proverbial lemonade out of the lemons. So at work, I've really tried to focus on projects and things that were on the back burner, things that I keep wanting to get to that I can't, working on the curriculum for the residency, research projects that, trying to get them off the ground or push them down the road a little bit, getting those manuscripts done. I love all the innovation that's come out of this sort of pandemic with the virtual learning environments, and we're doing grand rounds via WebEx, and we can invite grand round speakers that, maybe schedules they couldn't make it to visit us, in DC. So I think that's been an incredible opportunity. The residency programs have initiated these 3 consortia of online learning for the residents, and the residents love it. They really sort of taken advantage of that. So again, I just sort of love to see how we've adapted, using technology. At home, I've really tried to nourish the connections and cherish the time with my kids. I reflect back on, I'm a full-time working mother, and have a lot of guilt of the time that, the events that I've missed with my kids. And now I have that opportunity to be with them. So appreciate the gift of time. And, we're doing a puzzle, and, we take walks every afternoon with the dogs, and, everyone's at the dinner table. The kids are home from college. So really just embracing this new normal, if you will. And then the other thing that I've started doing in the last year and a half is I've taken on mindfulness as a strategy. So, anyone who knows me, I'm certainly not a yoga meditation type of person. And I had the opportunity to go to a mind-body medicine retreat that is offered to the Georgetown University School of Medicine. I don't know if you know Adi Haramati. He's just a wonderful leader in this space. And they asked all the program, we were voluntold that we needed to go to this retreat on mind-body medicine. And I went kicking and screaming because it was a 4-day retreat on the Eastern Shore. And I thought, oh my gosh, if this is yoga and meditation for 4 days, I'm going to lose my mind. And it was yoga and meditation for 4 days. And it was the best 4 days I have ever spent. And just really, kind of getting the skills and the tools to be self-aware, to disconnect, to, even if you have 5 or 10 minutes, just to be mindful, whether it's a breathing exercise or just walking outside and doing a mindful walking meditation. So, it hasn't been easy for me to embrace those, but I've really made a concerted effort, again, during this downtime that we have, is to really, work on my techniques with that and try to, incorporate it more into my daily living life. So.
Thank you. That's wonderful. So what I'm hearing is each of you has very different but important coping strategies. Some of them are attitudinal, just sort of, acknowledging what you're feeling, and then also being able to hold both those negative, if you will, emotions, but also the positive of gratitude. And Sonia, you were talking about just enjoying learning and innovating and, doing more of what you do well. So we can have both of those things at the same time. I think that's really important. One doesn't negate the other. The gratitude doesn't negate the grief or the loss or the anxiety, but they are both present, and that's called being human. But I'm just hearing a whole lot of wonderful coping strategies that are obviously quite individual. I wanted to point out something that happened I was recently peer supporting a group of, I think they were all physicians, 10 physicians. And I asked about, what are people doing? And somebody said, I've actually I've been doing like yoga for a half hour every day, and it's just been grounding me. And I actually said, I just want to call out, I was the peer supporter, this reaction that I had to what you said, which was like, oh my gosh, I should be doing yoga a half hour a day. And then a lot of people said, I was thinking the same thing. And I think one thing that we have to be careful about in the resilience wellness thing is not putting the shoulds to people, like this is how you should cope, or my coping is better, or you need to not just do yoga but also train for the marathon and eat organic food. And it becomes, you don't want it to turn into something that's like we're going to fail at. And again, it's not comparative coping strategies. We can share them, right? And I could share with you, by the way, Headspace, which I do every day now, has is free for healthcare providers. So you should know that if you wanted to do these meditations, we can share them without saying like, Bill, I really like to recommend, I think it's the meditation thing that's going to really work for you. And so that's really a dance with peer supporters, making sure we don't should people, if you will. I'm mindful of the time. Julie, okay, yep, I was going to say, I was going to start to close. So just being mindful of the time, there's so much more we could talk about, and I'd love to hear more. I realized I wouldn't normally do this in peer support, but I want to do it now because I forgot to do it at the beginning. So at the beginning of the last podcast, I actually shared that I'd had COVID, and I was asked to give an update, and you can all, as otolaryngologists, probably hear the difference in my voice between now and then. So I'm almost symptom-free. I've got almost 100% of my sense of smell back, which was the last thing to get better, and mild sleep disturbance. So that is all I have. And my husband, other than some persistent hyposmia, is fully recovered. So I'm just so grateful that I'm alive, for one thing, and that I don't seem to have any permanent issues. So I was asked, thank you.
Glad you're better.
Thank you. And I also want to say that the even actually from that podcast, the kind of support I got from colleagues, from you all when I was with you during the podcast, and then from colleagues across the country, just checking in with me and saying their reactions to listening to all of our stories, mine and Julie's and Bill's, was so important to them. That was so important to me. I mean, there's, to feel sort of held by or understood or listened to, appreciated by your colleagues. Again, that's what peer support is, and hopefully that's, I hope you do feel appreciated just generally, and then also after today. I'd like to thank all of you for sharing today, and I hope that these wellness episodes help those in our community as much as they've clearly helped us. Please continue to access the Academy's COVID-19 resource page, which is at entnet.org, for the latest updates, and you can visit ENT Connect, where we can share and inspire each other as we all make our way through this crisis together. Now, as always, we are one. Thank you all.
This has been Frequency, a production of the American Academy of Otolaryngology, Head and Neck Surgery. To download more episodes and our mobile app, please visit our website at entnet.org/frequency. That's FREQUENTCY.